Hi, everyone. Amy McMillan here from Treat Dizziness at Home. Today, I have a guest with me, Mrs. Chelsea Powers, who is a doctor of audiology and is a mobile audiologist with Pinpoint Audiology. She's the owner of that company in Northeast Ohio. So, Chelsea, thank you so much for joining me today.
You're welcome. Thanks for having me.
Yeah, and I'm just excited to kind of dive right into the field of audiology and let our listeners know how you may help them in their dizziness and balance journeys. So if you want, go ahead and introduce yourself, and then I would love to know kind of where people should expect to see you in their journey. Are you one of the first providers they see?
Yes, so I am a mobile hearing care provider. I primarily provide hearing exams, comprehensive testing of the auditory system. So usually when somebody is starting to think they have something going on with their ears and maybe even feeling a little bit of hearing loss and balance problems along with it, I'm a good place to start because I can help get you in the right direction. Um, with certain hearing disorders, sometimes we have balance disorders that show up along with them.
Okay, perfect. So I know that you're mobile, so you probably don't carry all that equipment with you, but I know you have education in some of the tests that might be useful in first helping diagnose or identifying any vestibular condition. So can we go through some of the tests that a person may incur when dealing with an audiologist?
Okay, so for starters, when you're going in for an evaluation, we like to start with the basics. So we definitely want to get a hearing exam first, examine the ear canal, make sure there's no ear infection that's obvious, where we would then refer to an ear, nose, and throat specialist to help medically treat that. But we'll start with the hearing test. So with the hearing test, at that intake appointment, it's not just, okay, we're testing to see if you have hearing loss, but we're also gathering some important case history from that patient. So we're looking for specific red flags that the patient is reporting, certain symptoms that may go hand in hand with certain disorders. So it's really important to have all this information written down uh, from the patient's point of view. So when did your symptoms start and how often is that happening? Is there anything specific that you're doing that you notice you're having symptoms of hearing loss or dizziness when you're doing a certain activity? So that's part of that process too, along with having your hearing examined.
Sure.
Mhm.
Okay, so you start with the hearing exam.
Mhm.
Anything else with pressure tympan?
Okay,
Yeah.
so as far as pressure goes, so tympanometry is typically one of the tests that we do along with a comprehensive hearing exam. So a pressure test, what tympanometry actually is doing, it's measuring the middle ear function. So that's the space behind the eardrum. So that helps us rule out certain disorders in that middle ear space. For example,
What kind of disorders would those be? Because
so
people want to know the names of some of these
exactly.
disorders.
So like a middle ear infection or
Okay.
otitis media. So
Okay.
sometimes people can have a little bit of problems with their equilibrium if they have fluid built up in the ear. So tympanometry is something that can help us say, oh, okay, well, this might just be something in the middle ear, and then we would refer to ear, nose, and throat for that type of condition.
Okay. Are there any tests like for otosclerosis and like the bones of the inner ear? What are you looking for there? Those are the conditions that I definitely am not well versed in identifying, as I shouldn't be as a therapist. But is there anything that you look like for an audiologist that you can see and help diagnose?
Oh, yeah. So there's specific characteristics for otosclerosis. So sometimes you can visualize what's called a Schwartz sign, which is just when you're looking in the ear performing otoscopy is what we call it. Looking at the eardrum, sometimes it has like a reddish pinkish hue or color to it, which is indicating otosclerosis. I mean, you wouldn't necessarily diagnose it on that alone. You'd be
Mm-hmm.
looking for specific characteristics in the hearing testing as well. So when we are doing the hearing exam, pure tone audiometry, where you're listening for the beeps, raising your hand or pressing a button, we're looking for at particular frequencies that we're testing. There's particular characteristics that we see in a hearing loss with otosclerosis. So
Okay.
that's another thing that we're looking for. And then you mentioned tympanometry before. So we're testing that middle ear function. With otosclerosis, when we perform tympanometry, um, otosclerosis is actually a stiffening of those bones. So we don't see as much movement in that middle ear, the bones in the middle ear, they're a lot stiffer. So there's a certain characteristic in that reading of the tympanogram that we're looking for as well. So a combination of all of these things are telling us, hey, this is really suspicious for otosclerosis, and then we would refer to an ENT that specializes in treating that.
Okay. So say for example, somebody sees a physical therapist first. And yes, they're the dizziness, maybe some hearing issues. That's what I might be looking for, balance disorders. Um, I should probably definitely, even if I start treating them, I should probably send that client to an audiologist just to make sure the bone function and the middle ear function is good, or else I'm kind of guessing, right? Like we should be collaborating to make sure we have the full picture. Um, so sometimes it's not just one diagnosis, but maybe even with age or something, we might have multifactorial. So
Oh,
even if you have
absolutely.
one diagnosis, shouldn't mean that you might be a great provider to get a fuller picture and then have a more comprehensive treatment plan. Sounds
Yeah,
like, yeah.
completely agree with that. With something like otosclerosis too, you definitely want to monitor that condition. Sometimes you see some changes in that type of hearing loss. Also, if somebody is going to see an audiologist, you'd want to get a copy of that audiogram to take to an ear, nose, and throat specialist, because if they do decide to do some type of surgical intervention, you would want to track your progress and track and see how effective that surgical procedure is before and after. So
Okay.
absolutely, there's a lot of collaboration that needs to be done in that
Okay.
case.
Now, what are some other conditions that you may be able to at least identify or pique your interest with your audiology exam? Are there any other conditions that you might be able to pick up on?
Oh yeah, absolutely. So I know since you're specializing in balance, um, we'll hit upon a lot of the common balance disorders here. So there's several disorders that can present with a hearing loss. And again, we're going through that case history, and we might even give you another questionnaire that's more specific to your dizziness symptoms. But there's certain disorders that have characteristics that show up in this testing that we're listening for in the patient's reports. So Menieres disease,
Okay.
that's one of them. That's typically fluctuating hearing loss, roaring tinnitus or roaring sounds in the ear. Um, you have that room spinning dizziness along with it. And usually it starts off in one side, but you can have it actually affect both ears. So
Okay.
that's something that we're looking for. Another condition is acoustic neuromas or vestibular schwannomas, which are they're benign tumors, so they're non-cancerous, but they are growths that are invading that nerve that's sending the message from our inner ear up to the brain. So those nerves that are um, responsible for hearing and balance, they're right next to each other in a small canal. So these sometimes you see balance disorders along with having a hearing problem.
Okay.
Another disorder is labyrinthitis. So if somebody has like a viral infection that causes some inflammation in
Mm-hmm.
that little the cochlea, the little snail shape house for our hearing system. If that gets inflamed, we can see some hearing loss with that as well. Let's see, some other ones, superior semicircular canal dehiscence. So
Mm-hmm.
that's another part of our balance system where the uppermost part of the balance organ, it has a bony plate that typically houses it, and inside is a more gelatinous membrane that's housing some fluid, and that bone tends to thin out and it's causing some fluctuations in that fluid. So you can have some
Does that always involve hearing loss? I think almost always.
typically
Yeah.
you have like a low frequency hearing loss, so
Okay.
that's a characteristic that we're testing for that, but it's also really sensitive to pressure changes.
Okay.
So that's something where tympanometry could come in handy. And sometimes people even notice, like they try to pop their ears, the
Mm-hmm.
Valsalva maneuver.
Mm-hmm.
They notice some symptoms with that where they're feeling dizzy when they're trying to pop their ears.
Okay.
And then there's something that's kind of similar to that, that disorder, which is a perilymphatic fistula, which is just like a hole between somewhere within that cochlea and that organ, where there's just fluid that's in places where it shouldn't be. And again, it's sensitive to pressure changes, and we see some hearing loss
Mm-hmm.
with that as well. So those are
Okay.
some dizziness conditions that we see that present with the hearing loss.
Okay.
But there's also some disorders that don't present with the hearing loss, where it's more specific to just the balance side of the
Okay.
system. And those would be disorders like BPPV, which is benign paroxysmal positional vertigo. So
Mm-hmm.
that's very common. I'm sure you see a lot of folks with that disorder in your line of work.
Yes, ma'am.
So that's something that a hearing test can actually help us rule out, because you
Okay.
don't typically see a hearing loss with that type of uh, vertigo or dizziness. Then we can say, okay, well, the next thing we can do is do what's called a Dix-Hallpike maneuver, which is something that unfortunately we're going to try to make you dizzy to diagnose that
Mm-hmm.
positional vertigo. And it's something that some audiologists do. Some audiologists specialize more in balance. With me, since I'm mobile and I primarily do the hearing test side of it, that's something I would refer out probably to physical therapy, because physical therapists such as yourself specialize in treating balance and BPPV. So that's something that we can rule out with our case history and looking at a hearing exam.
Okay. What about
Um,
migraine, vestibular migraine? Are you able to figure that out?
Well, it's something that doesn't present with the hearing loss.
Mm-hmm.
So that is something where we would do the hearing test, make sure it's not any of those other conditions where we would need to closely monitor the hearing, or refer, for, like a surgical consult, something like that. Um, Usually with a vestibular migraine, we would refer for medical management, so ENT and physical therapy too, to help stabilize their symptoms.
Yeah, I think
But
that's
it's
one of the
more,
biggest differentiators that I use. If you have the spell of vertigo, if it does not involve hearing loss, I'm thinking more migraine than
mhm,
Menieres. So that's just
right.
a big one that I look at, and hopefully with other things
Oh,
I'm able to help
absolutely.
guide people towards a possible cause.
And you brought something up that I wanted to make a point about too. Um, Only about 1% of the population actually has true Menieres. We
Oh.
tend to see it overdiagnosed when it's actually something more like BPPV.
Mm.
So, and quite often it just may be, a patient's gone to their primary care and they're looking for just some relief from that dizziness, and they say, okay, well, it sounds like Menieres. Let's give you some meclizine to help with that dizziness.
Mm.
Um, but in that case, they haven't really done the proper testing to determine that
Mm-hmm.
Meniere's disease. You really need a hearing test, and there's some other vestibular testing that you can do a deeper dive in to make sure and confirm that diagnosis.
Okay.
But Meniere's disease, you got to make sure you have those key characteristics where you have that fluctuating hearing loss, the that fullness sensation in the ear, that roaring sound in the ear, and then the episodes of dizziness.
Now, I do have a question from my community. If you have early onset Meniere's and you're just developing it, if you're not getting to an audiologist quickly enough, like after an attack, I guess one, do you have a recommendation of how quickly you need to get to the audiologist? And two, can it rebound before you can identify that there was a fluctuating loss? Or when it's early on in the disease? Because I understand that it could be incrementally
Mm.
dropping, but what if it's early on? Can we miss it?
Well, it's possible. Usually you see some type of permanent change with it. We usually don't see it fluctuate into an abnormal range and then back into a normal range.
Okay.
It is best to get to an audiologist sooner than later so you can establish, where that new baseline is, and
Mhm.
then track further fluctuations.
Okay.
With getting to audiology, though, it's more of a management of the hearing loss at that point. You'd want to you'd want to go to your audiologist because usually somebody with Meniere's is wearing some type of hearing aid to help with that hearing
Mm.
loss. So you'd want to
But
get,
even early on, how quickly should somebody get to after they have like an attack, or say they're 3 months in, and should we be getting to audiology within a week of that attack or during the attack? I've heard some interesting things.
I would say you'd want to make it while while you're stable. If
Okay.
you're actively dizzy and it's still fluctuating, as far as what we'd be doing on our end, we'd be looking to reprogram your hearing aids
Oh,
basically
okay.
to address that change in your hearing.
Okay.
At that point, if you've already been diagnosed with Meniere's, hopefully you're being medically managed.
I'm
Where
thinking these are for people who aren't diagnosed and they're still
Oh, if they're not
questioning.
diagnosed.
Yeah,
Okay,
these are
well
for people
then,
who aren't diagnosed.
yes, you'd want to go as soon as you're symptomatic, so we can pinpoint it and see
Mhm.
what's going on.
Okay.
And then, we'd get that first incident down, and if you're still having changes and fluctuations, we'd want to keep monitoring that and see where the fluctuations are taking you,
Okay.
basically, so we can get a starting point for your prescription. We'd still want to refer you for the medical management
Mhm.
side to see if we can get that Meniere's stabilized. Sometimes it can be treated through changes in diet,
Mhm.
just depending. There's been no cure for it, unfortunately,
Mhm.
but sometimes if you get the right person helping you manage that medically, it can certainly help. And when
Okay.
you're stable enough, then could potentially do some physical therapy too to help
Okay.
stabilize that balance system.
Okay. Let's quickly run through just like a quick of some of the other tests. So we have our hearing test, we have the pressure test. Let's go through some of the tests and maybe kind of what we use it for.
Okay. All right. So we talked about the hearing test, talked about the pressure test, which is tympanometry. Then we get into some other balance tests that's more specific to our vestibular system, or the balance system, which is in our inner ear.
Okay.
So when we are suspicious there's some type of deficit or weakness in our balance system. The next step, we typically refer for a VNG after you've had your hearing tests completed. And a VNG is video nystagmography. It's a
Mhm.
long word. So that's
Yeah.
why we call it VNG for short. But basically, this testing is taking information from our eyes, actually. And if it will allow, let me show my screen here. So our eyes and our inner ear are actually intertwined. So our balance system is very complex. So our eyes are sending information to our brain at the same time it's getting information from our ear. So for example, this is the vestibular ocular reflex. So when we turn our head, I'm still staring at my computer screen, so when I'm turning my head, my eyes and my ears are telling my brain information about which position my head is turning, how fast my head is turning. So these are some of the pathways we're checking with a VNG. So the patient, when they're having a VNG, they're actually going to be wearing some goggles over their eyes to track their eye movements.
Okay.
And if there's anything different in the eye movement, something that's not typical, then that can be an indicator that there's a weakness somewhere. So the VNG itself can help us determine, okay, is it something that's going on in the eyes, in the ears, those peripheral systems outside of the brain that are further away from the brain? Or it could tell us, okay, well, we're not really seeing anything in the ear part or the eye part, but it's actually more in the central part where the brain is.
The brain.
So it helps us determine central or peripheral, or is it the organ for hearing and balance, or is it something going on in our brain?
Yeah. Or is it completely healthy and
Yes,
we
which
have
we
to
would
go a different route, like
hope to.
cardiology or migraine or rheumatology. There's so many
Absolutely.
different, but yeah, VNG can be so valuable to say my brain's healthy, my inner ear's healthy. This is not the path you want to go down. Let's go to a different provider. So that's a great test. Yeah.
Yeah, absolutely. And then if you do have something going on too, it can help us determine, okay, is it the left side or is it the right side
Mhm.
that's causing all that difficulty?
Yeah. Okay, so we did the VNG. Anything else that you commonly do? I know that I'll butcher it, so I'll just say ECOG and the VEMP test. I know those are some tests that I seem to come across my desk as well.
Okay. Yeah, you may have seen those come up here and there. ECOG, I would say, is a little bit more specific to diagnosing Meniere's disease.
Okay.
And sometimes the semicircular canal dehiscence, that's the one
Mhm.
with the weak bony
Okay.
portion.
Mhm.
So it's not really for like all of the hearing, or I'm sorry, all of the balance disorders. It's a little bit more to pinpoint like those conditions.
Okay. Now,
Um,
what about the VEMP? What do you use that for?
so our balance system, let me screen share with you again. All right. Let me go back a few. So our balance system, so everything I have in the green is a part of the balance part of the inner ear. Purple is more of the hearing part. So there's actually 5 organs within the vestibular system that are responsible for certain types of movements and sending those signals to the brain. So and a lot of the other testing that we discussed so far is in reference to our semicircular canals, these little guys right here. I'm not sure if you could see my cursor, but they're
Yep,
the
we
little
can
half
see.
loops.
Yep, we can see.
Okay. Okay. And then the vestibular nerve.
Mhm.
But when it comes to the VEMPs, it's actually a little bit more specific to these other organs, the utricle and the saccule. So since the other testing is more limited to like the semicircular canals, we're just trying to pinpoint what, what condition, if all else you're not finding
Mhm.
anything definitive with, like your VNG, you could try a VEMP to see if there's something going on with your utricle, saccule, and then certain portions of the vestibular nerve.
Okay. Are there any conditions that you can speak to that you would see abnormal VEMP tests? If you had an abnormal, or, I mean, I know you have to take it with other symptoms, but anything off the top of your head that you'd be like, huh, maybe this diagnosis.
Um, it's not something that I come across often, so I don't have anything off the top of my head, but I can
Okay.
always get back to you
Okay.
on that.
I know
Okay.
with superior canal dehiscence, I've seen some abnormal VEMPs before. Um, Interestingly enough, just and maybe you can speak to this, degeneration with age, so disequilibrium with aging, so the hair cells as we age, those actually will be diminished. So can you see, I swear you can see some diminished VEMPs with age as well.
It's
What
possible.
else? Yeah.
Yeah, this testing itself too. This one's not so much tracking eye movement, but there's
Yeah.
actually these electrical potentials that are
Mhm.
generated by the cells that you mentioned. So our body is just pretty much run off of electrical impulses. So
Mhm.
yeah, you can see some degradation of those particular organs over time. Sometimes the effects of aging can
Yeah.
affect how strong of a response that we get with that testing.
And I had one particular patient that suffered from mast cell disease. And very specifically, the saccule was being attacked
Mm,
by mast cells. It was very interesting, just that particular, it was very specific diagnosis, and that particular test was positive. But as you may assume, she had a very hard time standing upright
mm.
against gravity. So she would be sitting in the chair a lot, because there wasn't a lot of electrical input from those particular organs. So yeah, so the VEM test is very specific, but it can be useful. Let's see. I had another interesting case, and I think we should ask this for my community. I've had a patient who said, I was getting my ears cleaned and I developed vertigo during it, and I've been dizzy ever since. Any side effects to getting your ears cleaned? Have you
Okay.
ever heard of that before?
I'm wondering how they got their ears cleaned. Did they have their ears flushed with water?
I actually don't know, but does
Oh,
it
okay.
does it matter if it's
Well,
water versus an instrument?
yes. So with irrigation or using water to remove earwax from the ears, it's really important that that water is at least at body temperature.
Okay.
If it's too hot or too cold, it's actually stimulating what we call a caloric effect. And that's actually one of the test batteries of the VNG when we're intentionally trying to make you dizzy. But um, this extreme change from, your body temperature to cold or to too hot can make a person dizzy. So if they're continuously dizzy though afterwards, I'd be curious if something happened as far as um, like a BPPV where you have a crystal that kind of got knocked out of place, maybe due to that extreme temperature change.
Hmm. Yeah, I've never heard of like a temperature change causing BPPV, but
Right. So it's not typical that the dizziness remains after having earwax removed. So I'm wondering if that was something that may have potentially been there.
yeah.
But as far as I know with having, earwax removed and just using water irrigation, it's common that people experience a little bit of dizziness if that water temperature is just a little bit off from their body temperature.
Interesting. No chance that there's like a fistula or something like that of the outer. Just asking.
Um, It's possible if you're putting pressurized water in the ear, so any change in pressure that's eliciting dizziness, it's potential that there could be a fistula as well. It's one of those things, of course, you'd require further testing to
Mhm.
determine, but you definitely want to make note of the patient's report during that procedure and follow up on it. Because yeah, if there's no improvement or they're noticing, those with any other pressure changes, they're having that dizziness. And that's something that definitely needs to be further evaluated.
Yeah, but not anything that you typically should see. Cleaning the ears, instrument water should be pretty darn safe.
Right.
Yeah.
Usually, yeah, it's pretty straightforward. I don't have any issues. Of course, I always check history before using any water to irrigate the ears. You wouldn't want to use irrigation if somebody has a history of having a hole in the eardrum or
Mm-hmm.
even surgical ears. Your ears can be a little bit more sensitive with
Okay.
having scar tissue or just a weak eardrum.
Okay.
In that case, then your provider would use some type of instrumentation or suction.
Okay. All right. One last question. Any cases, any one big case that stood out that you did an audiology exam and you're like, oh, this one caught me by surprise.
Well, I recall back in when I was in grad school,
Mhm.
actually, I had a patient where I was doing more so the follow-up with him and ongoing monitoring of his hearing. But it was interesting enough, I want to share with you if you'll allow me to share my screen one last time.
Sure.
And this is something I just like to stress the importance of follow-up and monitoring your hearing and finding the right provider. So this is the case, we'll call him, Mr. C. So Mr. C had been to an outside clinic. This is outside of where I was doing my clinicals at the time. And he initially just had hearing loss that he presented with, no other symptoms. So he tried at least two sets of hearing aids with this other clinic, and it just never sounded right to him. And then he finally came to my clinic, and by that time, we had compared his audiogram from the previous clinic with our clinic, and we're seeing a difference in hearing. So we were monitoring, and we did eventually fit him with a hearing aid. But as you can see, there's this left ear, which is indicated by the blue X's, versus the right ear, indicated by the red circles. You could start to see there's a difference and there's a shift. So as we're doing the follow-up care with Mr. C's hearing aids, he's saying, you know what, I'm starting to notice, the hearing seems like it's getting worse. I'm not hearing as clearly in the right ear. And I'm also starting to feel wobbly when I walk. I'm just drifting to my right side. So, of course, we referred out to neurotology. He had an MRI, and turns out he had it's a facial neuroma.
Okay.
So it was on on the facial nerve.
Okay.
So in his particular case, though, it was right where everything was bundled together. You have your facial nerve, your auditory nerve, and your vestibular nerve, everything bundled together. So this poor fella, had facial paralysis that ended up happening later on, along with balance problems, along with hearing problems. But in this case, seeing that difference in the left ear and the right ear is what helped us make that referral out to neurotology,
Okay.
as well as, those symptoms he's reporting to us too. He's saying, hey, I'm having, this wobbly sensation. I'm drifting off to the right. And then some of the test scores as well with a hearing configuration like the one on the left, he's scoring a lot more poorly in that right ear with some of the test batteries and what you would expect with somebody who doesn't have
Yeah.
a growth on the nerve.
Okay.
So you want to definitely monitor something like this over time. Sometimes the surgeon, they don't want to do surgery right off the bat, because sometimes these are really slow growing. But once you go in for surgery, it can really have an effect on your balance and your hearing, and in his case, his face as well, since it was so close to all those nerves, the facial nerve, auditory nerve, and the vestibular nerve.
Well, very interesting. So yeah, what I hear is just because you have one test doesn't mean you don't need further follow-ups, because
Absolutely.
that it could be something that presents itself later, more clearer picture. So no, that's a really great find. So that kind of concludes today. Dr. Powers, we just want to thank you for your time and your knowledge. Make sure if you have any questions at all to drop them in the comments below. I'll make sure to get those answered. And I will leave Dr. Powers' information in the description of the video. And until I see you next week, stay healthy, stay steady, stay strong. Okay.
Thank you.
Yeah, let me see if I can stop that. Stop.